Oh, okay. How to practice self-advocacy as a person and cancer survivor. Self-advocacy was designed by Van Roosen and et al. And Jonathan's probably much better at referring to research than I am. Back in 1997, as an individual's ability to effectively communicate, convey, negotiate, or assert his or her own interests, desires, needs, and rights. It involves informed decisions and taking responsibility for those decisions. So it's not only communication, it's not only stating your needs, it's also, and I think this gets lost a lot, it's also taking responsibility for your decisions. That's a big part of self-advocacy and a big part of having a respectful relationship in self-advocacy or relationships. So let's talk about an individual's ability to effectively communicate, convey, negotiate, or assert his or her own interests, desires, needs, and rights. And again, this is self-advocacy involves an individual's ability to effectively communicate, convey, negotiate. And that can be uncomfortable for some people, negotiation. Assert his or her own interests, desires, needs, and rights. A pillar tool for effective communication and self-advocacy or self-advocating is keeping a journal. I'm not saying you have to do this, but I have found it to be a tremendous tool for me. It can be in your phone. I carry a very small book. I don't know if anybody can see this, that I keep as my journal, and I write the date in it as I'm going. You can use a dated journal, whatever you want to use. You can talk into your phone. I think that might be a little bit harder to page through, but there are so many reasons why a journal is a tremendous tool for communication and self-advocacy. First of all, you can jot down questions for your care team in a consistent place as they occur to you. So you're watching TV one night and all of a sudden a question from your appointment 2 days ago pops up in your brain. Take your journal, write that question down so you have it for the next appointment, or you can message it to your doctor. Also, when you're writing it down, you can think about how do you want to word that question? And this goes into our next point, make talking points for conversations that may be challenging. This is with your provider, your care team, and in your personal relationships. Sometimes it's hard to express fatigue, or it's hard to express that you're just not feeling well, or you were cranky the other day and you snapped at someone that you shouldn't have, but they also did something that pushed your buttons. So talking points for those conversations are helpful rather than just diving into the conversation. And it kind of helps you when you start writing down talking points, you'll find yourself developing a more respectful conversation in those talking points. Your journal gives you an organized and prepared appearance with your provider, and this is important because your provider is then going to remember, or the team members of the provider are going to remember that you know what you're talking about. You come in prepared, and they are going to make sure they're more prepared because they're not going to want to be caught behind the 8 ball with you. It is a tangible symbol of your intent to have a positive outcome. And your journal also gives you something to look at, something to look down to if you're having a hard time maintaining eye contact, and something to hold to give you strength and courage because your thoughts are in it. It is such a tremendous tool, whether it's your phone or your journal, written journal, to hold on to during your conversation with your provider. Paging through it makes you look more informed. You are more informed when you're going through it and you're relaying your talking points or you're relaying your symptoms, which we'll go into shortly. Discussing personal experiences is also a pillar of self-advocacy. Make notes in your journal about personal experiences you wish to discuss, such as an intimate kiss or touch that left you feeling great or not so great. It didn't feel sincere, or it just didn't feel right. An experience with being stuck in the arm, and we talked about this last month. for an IV or for blood work many times over, and you have a port that can be accessed. An encounter where you felt you were not listened to in sharing critical symptoms or a traumatic experience or your feelings. So write down his personal experiences in your journal. Keep it short, keep it succinct, because you don't want journaling to become overwhelming. You want it to remain a tool for you that you go to because it is a tool, as opposed to an overwhelming. It's not a diary. It is not, it serves as in a way a diary does, that shows your feelings, but it's also serving many other purposes. So keep those thoughts and those experiences that you're writing short, unless you're finding that you're having like a what's it called? I can't think of the word right now. Catharsis in writing it down. That might be helpful too. But anyway, keep your journal succinct. Any notes you make, you'll remember what you're trying to talk about. Write down talking points for conversations that may be challenging. Also in your journal, and you can have a section for each one if you want to mark it off with a ribbon or a sticky tab, set an agenda for your next appointment or conversation. That kind of goes along with talking points, and be intent on a positive outcome. That is so tremendous. Even if you're going in to share bad news or hear bad news, you can still have a positive outcome in that conversation, in terms of having a collaborative conversation, and a conversation where you feel confident about wrapping your head around what is happening and what your steps forward are. So that intent on a positive outcome is going to help you keep your side of the conversation respectful, and so on. Oh, I'm hitting the wrong keyboard to get. I was having fun last night with my animations, could you tell? Keep a tone, stance, and attitude of respect towards other people with whom you are discussing your issue. Be prepared, because it's a two-way conversation. Be prepared to listen attentively and respond with thought and care after you communicate regarding your experience. And again, be intent on a positive outcome. They're going to have a response or reaction to what you say, and you need to be willing to listen to that and think about it and respond thoughtfully and mindfully to that. And if you can't right at that moment, just say, I need to think about this, rather than reacting with anger, because that's going to be counterproductive. So avoid adversarial conversations or tones. Right now, the way communication is often set up with providers, you can send a message. I understand with UPMC, sometimes that's not so easy with some providers, but there should be a nurse or someone that you can reach out to. But you can send a thoughtful note after the conversation, or you can just write down thoughts for your next conversation with your next appointment. Once a collaborative conversation is started with your provider, it will be easier to continue in the same vein, because this is going to it's going to feel more natural. Collaborative conversations are a pillar of self-advocacy. A collaborative and engaged conversation is another step toward advocating for yourself. And in collaboration, you're asking relevant questions and answer the questions that you're being asked of you openly and honestly. You're being asked for a reason. You're collaborating in this. And that goes with your provider, and also goes with, as long as you feel that it's being asked respectfully, it goes in your personal relationships too. So NCCS, which is National Cancer, I had the what this acronym stands for. I think it's National Cancer Coalition Survivor Network. I have to look up at it, or I'll look it up again. But anyway, NCCS, which is an excellent, I have it in another slide too, excellent website to go to for information. Negotiation skills are necessary in every aspect of life, whether dealing with cancer or any other challenging circumstances. Some of us are better at negotiation than others, but all of us can achieve some degree of skill in this area. Again, writing down your talking points will help with that. Actively listening will help with that. Negotiating in order to get your needs met may require you to step out of your normal comfort zone. It does not mean you become confrontational, but rather that you negotiate about issues that are of personal importance. National Coalition for Cancer Survivorship. There we go. It's a wonderful website full of great information. Speak openly and honestly with your team. Make sure your doctor listens and understands your needs and your concerns, and repeat back to your provider what you've interpreted from them, because what you repeat back may not be what they meant, and they'll let you know that. And so that's a really good way when you're talking about something complex or something that you're having a hard time wrapping your head around, to make sure you're understanding what they've said to you. Or if it's important, even if it seems clear as day, repeat it back to them to make sure that you understood them correctly. Understand that being informed and asking questions does not mean you're questioning your provider's knowledge or intelligence. You are asking questions and researching, as part of your responsibility, researching to be informed, to allow you to have a better understanding, and so that you can believe all of your reasonable options are being openly discussed, or at least what you're reading about, you can put out on a table and hear why it might be a good idea, or why your provider thinks it might not be a good idea. Be respectful and honest with others about your questions, your needs, your concerns, your ideas concerning your care, how you feel, and how safe you feel. That's important. That came up last month when we were talking with the several IV sticks, with someone that was in CT scan, or I'm sorry, for a GI procedure, and another person, I think, that went for lab work. Don't be shy. Per the experts at Johns Hopkins, this is your chance to address your concerns and ask your questions. Set an agenda. Be honest, ask questions, work collaboratively, and expect a good outcome. Many doctors' visits last only 15 to 20 minutes. That's why setting an agenda can be so valuable, because you make sure you are getting the most out of that time when you have face-to-face time with your provider. It's important to prioritize your concerns rather than try to recall what your questions were, and also to make sure that you're hitting your top concerns, or the concerns that you wanted to address with this agenda you established. Introduce your topics at the start of the visit or before your visit via note to your doctor, with your electronic medical record. And you can say, these are some things I wanted to discuss at my appointment. Gives your doctor or your provider, your advanced practice provider, a chance to look at, or physical therapist, dietitian, whoever it may be, a chance to research your questions as well before your visit, so that the time is well utilized for both of you. Bring a friend. That's important, especially if you're feeling overwhelmed. They can help you with note taking. They can confirm everything you've heard, and they can fill in the blanks, and they can just be good old-fashioned moral support. A second set of ears is often helpful with provider visits. Does anybody have any thoughts or questions so far? Self-advocacy involves making informed decisions and taking responsibility for those decisions. That was the second tenet of the initial statement we read. There we are at a decision point. And I'm sure a lot of you feel this way many times. A journal is, again, a pillar tool for decision-making and taking personal responsibility and self-advocating. Keeping a journal can be a tremendous tool, as we talked about. Track and trend your symptoms in your journal. So have a specific spot in your journal for doing that, or you can do it by date if you prefer. I think having a specific section is helpful, but however it works best for you. And so let's say that you are noticing you're developing diarrhea 5 times a month, and you start trending it, and it goes on for 2 days, and then it goes away. If you start writing down when that's happening, you can start maybe making associations, but it's still important to write down the frequency that that's occurring, the other symptoms you're experiencing with it, like, do you become cold and sweaty, lightheaded? Do you feel dehydrated? Do you feel very tired? Does it make you lose your appetite? Are you unable to drink things? So on. Do other things seem to irritate it? But you can start making connections when you start tracking and trending symptoms, why that might be occurring, to help you eliminate causative factors. The other thing is, whether or not you're able to eliminate causative factors, bringing that into your next provider appointment, or notifying your provider if it's happening frequently, which is very important. is critical because you have real data in front of you as to how often this is occurring. And they then can take that and put that in their note. So and so says this is happening definitively 5 times a month at this point after their treatment or after their radiation treatment or whatever is bringing it about, or after a certain medication they're taking, or after they eat this. But that may also help with your dietitian. It really depends on what the causative factor may be. You may not be able to pinpoint, but your doctor may be able to. But having that real data is invaluable because your doctor will then take that real data and go to other providers with it, as opposed to you sitting in your appointment and just recalling off the top of your head. When it is real data, they really are able to have very useful conversations with other experts regarding your symptoms. Track ideas or treatments that you think may benefit you to discuss with your care team. And again, jot down your questions like we were talking about. Make notes regarding important conversations, such as with your health insurer or your doctor or anybody else that is something you need to recall. Who, what, and when. Who did you talk with? What was discussed? What day and time? And I should have written down here resolution too, or follow-up you may need to do. Inform decisions, ask questions, and gather information. Use valid and reputable sources to gather information. And you may have other sources as well, but these are ones that I consistently rely on that I think are excellent. The American Cancer Society website, the National Comprehensive Cancer Network, there's a patient resource area in that is just chock full of information. Cancer.net, which is the American Society of Clinical Oncology, Mayo Clinic, Cleveland Clinic, and Memorial Sloan Kettering all have an amazing plethora of information on almost anything outside of cancer care, any kind of surgery you may be having, complementary treatment, going hiking, what you need to be careful of. It is just amazing that what they cover. Those are really also Harvard, which I forgot to list here. Harvard has a great website too for patients, and National Coalition for Cancer Survivorship. But these are I write freelance, and these are my go-to sites often, including Jonathan will probably be familiar with this, a publication called Nature. Those are my go-to places for evidence-based information. But these sites have exceptional breadth of information, exceptional writing, and patient-friendly tone or patient tone-friendly information in them. I just think they're great. Don't be shy. For experts at Johns Hopkins, again, set an agenda, be honest, ask questions, work collaboratively, and expect a good outcome. Another part of taking responsibility is being honest. Be honest about your worries, your concerns, your symptoms. Don't be afraid to bring up pain or a feeling that's bothering you, even if it's embarrassing. It could be vaginal pain, it could be rectal pain. Your doctor's job is to help you feel better, and he or she is required to protect your privacy. And trust me, they have heard it all. Nothing will surprise them. It's hard for us a lot of times to open up, but they will listen to you respectfully, and they'll talk with you about it, or they should rather, and they'll work with you to try and resolve it or get to the bottom of it or help you feel better. But it's important that you share that information. They're not mind readers. Take responsibility by asking questions. It is okay to ask questions. That is your right, and that's your responsibility in self-advocacy. If a provider ever tries to make you feel bad about asking a question, if you're comfortable doing so, share with that provider they've eroded the trust that you have in them with their attitude. And possibly consider finding a different provider depending on your response. They could simply be having a bad day and didn't even realize how they came across, and they will probably be very apologetic. If they get very defensive or just brush you off, that trust with your provider is critical, and you may want to ask to be seeing a different provider in that practice. The other thing is you can also go to your insurer and ask them for another in-network provider in that same specialty. You may also possibly also share, say, with that provider's physician's assistant or nurse practitioner, how you felt. That might be an easier person for you to have, or their nurse to have a talk with and share what happened. They may be able to be a neutral go-between to let your provider know if you're uncomfortable bringing it up. I've done that for patients before, and it's actually worked out usually very well. And oftentimes the provider did not mean to come across the way they did, and that oftentimes the relationships were salvageable. Study and understand your health insurance coverage. That's huge in taking responsibility. It is important to understand your choice of facilities and healthcare providers, your co-pays, your co-insurance. Make use of your health insurance member services. They're there for a reason. Call them. I know sometimes it feels like the wait is forever, so make sure you set aside some time, but usually the people that work there are experts. They should have all of the information in front of them, or they should know who to ask. But make use of them. They're there. Make them a part of your self-advocacy team. You may also have a case manager through your health insurance company or a navigator through your healthcare system. They can help you too. Don't be afraid to change providers, which we just talked about. If your current provider attempts to intimidate you from advocating for yourself or talks over you and ignores what you have to say. And again, your insurance provider can help you possibly help you find another provider. Your navigator can too, a case manager. Insist on comprehensive, coordinated, and continuous care. Good cancer care, and this is from the National Coalition for Cancer Survivors. Good cancer care involves doctors, nurses, social workers. As you know, I'm preaching to the choir here. Dietitians, all kinds of physical therapists, occupational therapists, speech language pathologists, all kinds of people. They're working as a team through your care. Make sure that one member of your medical team is designated, if you find that you need it, as your advocate. That could be your navigator, your nurse coordinator, your case manager. If you feel the need to do that, to help you coordinate your care and guide your progress through treatment, especially if you have a complex treatment, so that things don't fall through the cracks, because that can happen. So make sure that your navigator can really help with that. If you most places do have at least a nurse that is in the office with a particular provider that will help you coordinate care. And if they need to pass you off as you transition to another specialty, they may not be able to stay with you for your entire journey. Ask them to do that with you, and to give a report to the next person and meet them, talk on the phone, or understand what the next person's name is, what their position is, what their phone number is, so you can call them and reach out or message them and establish a new relationship. But having that continuity is really, really helpful. If you experience pain or symptoms, make sure you ask for assistance. Speak up. Don't wait for your next appointment. That is so important, that you call or you message and you let somebody know. And if you don't get a response, call back. I know that's frustrating, but it happens. As we talked about, a case manager from your insurance, a navigator, or a care coordinator from your healthcare system can facilitate comprehensive, coordinated, and continuous care. Again, communicate promptly if you're having symptoms. Effective treatments are available for many of the symptoms for cancer and for the symptoms caused by cancer treatment. Psychological counseling, social services, dietitians, rehabilitation are among the support services that should be available to you. You may also have complementary medicine services and benefits. So again, advocate for yourself, ask your healthcare system and member services, and then also ask your navigator or your care coordinator or your doctor or someone in your cancer care network what complementary medicine is available or who they would recommend. So take a moment, put yourself in your doctor's coat. We just talked about how oftentimes there's only 15 or 20 minutes for a visit. Be fair to them, because they're seeing several patients in one day. You are important to them. Trust me, you are very important to them. I know this because I work with them, but they're seeing many people that are important to them. So be fair to them and your cause in question. So making that agenda is huge. Springing a topic on them about something unorthodox. If you let them know ahead of time you want to discuss this, they'll give them a chance to look it up. So consider messaging your doctor, your advanced practice provider, such as your CRMPPA, your physical therapist, your dietitian, ahead of time before introducing your challenging or unorthodox topic or question before your appointment. Why self-advocacy is important. Being a proactive, educated cancer survivor, you can impact the quality of your life and the health care that you receive. Advocacy gives you a sense of stability and a feeling of regaining some control in your life. And this is so important and it's so precious when you are dealing with cancer diagnosis and cancer treatment to regain control. Advocacy is confidence building. In a way, it helps you face challenges that seem insurmountable. They're really not insurmountable. They may be very overwhelming, but if you break it down into smaller pieces through your talking points, through the notes that you make in your journal, through advocating for yourself, you find that you will build confidence. You will come into the office prepared, and you will find that people will much more likely interact with you in a positive manner, in a helpful manner. Advocacy is a way of reaching out to others. It can be as simple as talking with your doctor or nurse, asking your doctor or nurse for the same as someone to talk with who has survived your particular type of cancer. Advocacy truly, truly can improve the quality of your life across everything. In your relationships, if you advocate for yourself respectfully, in your care, in your relationships with your health insurer, in your relationships with your employer. Self-advocacy requires participation in decision-making progress. In a decision-making process. Information-seeking skills are developed by educating yourself about your cancer. Sorry, I have a typo in there. About your cancer, your treatment options, possible side effects, and available support services. Those are all things that when you use a valid source of information, and that's important, using a valid source of information, because you're going to find all kinds of rhetorical stuff out on the internet. You're going to find things that are not necessarily evidence-based, or someone may be talking about their breast cancer or their GI cancer, but it wasn't the same type of cancer that you had. And you can't take what they say as truth. You need understand your diagnosis, understand your pathology, and use that to look up your information. Communication skills development is designed to help you organize your thoughts before you speak. They can be applied to thoughtful interactions with your family, friends, and caregivers, and avoiding unnecessary misunderstandings. Again, your talking points can help with that. It is important to identify the problem and know how to articulate it, how to talk about it, whether or not to have treatment, or if so, what type of treatment, considering clinical trial, what physician to choose, and so on. Do not feel that you have to make decisions alone. You have other people. You have your cancer care team. You have your advocate that comes with you. You have your significant other or a child or a parent to bounce things off of. And also, when you're getting ready to have a difficult discussion, whether it be with your significant other, your doctor, a friend, an insurance company, consider bouncing your thoughts off with a trusted friend or caregiver, like your talking points. You would be surprised how much you end up changing your talking points and how much you end up fine-tuning them if you practice with someone first. This is especially important with talking about sexual intimacy with someone. Survivors and their supporters report that you can improve your ability to cope and your quality of life if you strongly insist on having a nurse or a nurse navigator, care coordinator, or case manager assigned to you. Select one family member or friend as your representative if you're unable to speak for yourself, and we're all asked to do this. Articulate your symptoms to your doctor. Don't wait to be asked. If necessary, use your journals to your documentation, and avail yourself, as you are doing right now, of peer support, self-help groups, support groups, professional help. I'm saying that we're a support group. I'm not saying I'm professional help. Responsibility includes paying attention to your body and its cues. Your provider is an expert in their discipline. You are the expert in your body. You know how you feel day in and day out. You understand how you react to various medications, treatments, foods, salves, textiles, stressful situations. You understand your body, and you understand when something feels different. When something feels different, write it down. If it happens again or causes a lot of concern, let your provider know about the event, the nature of the sensation, and what possibly brought it on. Understand your medications. That's huge, 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 huge. And I'm sure that all of you groan when you go into the office and someone starts reviewing all of your medications with you. That is such an important exercise. And it is painful to go through it time and time again. But they are tasked with doing that, and there's a reason. It protects your safety. It makes sure that everybody's on the same page with what you're taking and when you should be taking it and so on. And that is so critical because so many times things fall through the cracks if that's not done appropriately. Really important things fall through the cracks that can affect your quality of life. So embrace it and participate in that medication reconciliation. Understand what medications you're supposed to take and when you're supposed to take them. Understand if they should be taken, each medication should be taken with food or on an empty stomach, what time of day, what that medication you're being prescribed is intended to treat or alleviate or make happen, potentiate. Ask if a new medication might interact adversely with your current medications. We are now getting alerts when that does occur, but it's good still for you to ask. Pay attention to the review of your medications that should occur with each provider's visit, also known as medication reconciliation. Be an active participant in it. I realize it seems very repetitive, but especially when you're on a lot of medications, it's important to go through it. Be honest if you've stopped taking something, like you just decided you hate how you feel on it and you stopped it 2 weeks ago. Make sure you tell your provider. Also, it's really important that you share your over-the-counter medications, your Tylenol, your cold medicine, your vitamin supplements, your herbal supplements, because they all can affect your liver, they can affect your kidneys, they can have interactions with your chemotherapy or other medications that you're taking. It's really important that you are honest about what you're taking. Even if you feel like your doctor rolls their eyes, you can say, hey, I really do feel better when I take this. Explain that or ask before you start taking it, and let them know how you do taking it, because they might actually start paying more attention too. You'd be surprised. Responsibility includes knowing your medications. So keep track in your journal. Is the medication working for the reason it was prescribed? Do you suspect an interaction that maybe isn't common, that you notice that you're starting to feel a certain way when you take two medications on the same day or near each other, or you're feeling a different way now than you were before you started a new medication? Is there a medication causing any uncomfortable side effects such as dizziness, a rash, or nausea? Anything, lightheadedness, itchiness? Would you like to attempt a trial pause to see if those side effects go away and see if you can definitively associate them with your medication? Pull your provider into that conversation, into that question. Hey, I'd like to pause this for 2 weeks because this new medication, because this is what's happening. And I want to know, is it from the medication or is it something else? But let them know what you're doing and why. There may, you need to make informed decisions. There might be a reason specific, there might be a need to taper down on that medication and you didn't know it, or there might be a very specific reason you were prescribed that medication. So communicating that lets you make an informed decision as to whether or not to stop. Is there another medication you read about that's supposed to do the same thing that you would like to try? Bring it up to your doctor. Can you afford the medication? If not, ask if there's an alternative or financial assistance program for the medication. Again, your doctor or your provider or your pharmacist isn't going to know that you can't afford the medication unless you tell them. Always include or that your copay assistance isn't working or it's not going through on your insurance like it's supposed to. You need to inform people. Always include your provider in your decision to stop or reduce your medication before you actually do. Unless, of course, if you just feel horrible on it, stop it, then call them. But make sure you're calling them promptly because they need to know and they need to work with you to make sure that nothing worse happens. Any questions or discussion so far? A little bit about symptom tracking log. There are different side effects, long-term and short-term, from different cancer treatments, and experiences can be different among patients, and it's important to discuss it. Reporting side effects early to your healthcare team, I should have healthcare as one word, can get patients the relief they need as soon as possible, but also if you're like on a immune checkpoint inhibitor, which many of you probably have been, it's critical that you report those symptoms promptly, because your oncologist needs to work with you to get that immune response under control so that you can stay on your medication without issue. And we did a presentation about that. We can probably repeat that again in the spring. Immune checkpoint inhibitors. Research has shown that using patient-reported outcomes, or PROs, can improve care and improve outcomes. Now, PROs are when there is a formal program for symptom reporting, and I'm not seeing a whole lot of that in Pittsburgh, but you can tell me if I'm wrong, or in Pennsylvania. However, you can do it on your own. You track your symptoms in your journal, you write it down, and you report it to your providers. My experiences, as I said, your providers, when they have real data, the way they act with real data and the way they work on real data is so much more concise when they have your real symptom tracking data than when you're recalling off the top of your head in a doctor's office. They take all of what you say seriously, but they take a track symptom so much more seriously. And they know that you're not just recalling off the top of your head the frequency. They know you have the actual frequency when you have it documented, and that is gold to them, and it becomes gold to you. It will help your provider make better decisions on how to manage your symptoms. Absolutely and positively it will. And it may give you insight into triggers, which we talked about, that you did not otherwise realize if you start tracking and trending what's happening. Use your symptom diary also, as we talked about in another section, to document important conversations. Trend your tumor markers to understand what's happening. Trend how new symptom management measures work. So let's say you were documenting nausea and your provider is trying you on a new nausea medication. Write down how it's working for you. How is that new medication making a difference after a week or 2 weeks, or a change in your diet that you made, or both? Log your questions for your doctor with a space left after for the answer for each question. So in summary, when you take responsibility for your healthcare decisions, you take responsibility for understanding your medications. You communicate respectfully and clearly. You keep a journal. You make an agenda. You write down talking points. You listened mindfully, and you go into the conversation or appointment expecting a good outcome. You have an excellent chance of gaining traction and satisfaction in your healthcare. And this is absolutely. And more than likely, you will have a more open and honest relationship with your doctors and other providers, and you will likely improve your personal relationships with those who are on the journey with you. Okay,